It's always very exciting for a cardiologist to see people getting excited about heart disease. So what we're doing is we're introducing people to all the different phases of heart disease. The more educated you are about what a heart attack is all about or what a stroke is all about, the more you're liable to do something for yourself or a member of your family.
We're focusing on trying to prevent stroke, and it's important to know what your risk factors are. And some of the screening modalities that Summit Medical Group offers is blood pressure screening, blood pressure management, diabetes screening, diabetes management, tobacco cessation, smoking cessation is very important into modifying those risk factors. Imaging modalities such as CAT scans, MRIs, and ultrasounds can be very valuable to know what your personal risks are.
Nutrition and heart health are related. Actually, they're very intertwined because when you eat a heart-healthy diet, which would be lots of fruits and vegetables, high-fiber breads and grains such as whole wheat, the best sources for heart-protective foods are your omega-3 fatty acids. That would be your fatty fish, for example, salmon and halibut and fresh tuna, your avocado, nuts such as almonds and walnuts, and again, you go to your leafy green vegetables because they're more antioxidant power.
The most important thing we're talking about today is working to your target heart rate to get the best cardio output. So we're teaching everyone how to figure out their maximum heart rate, which was just 220 minus their age, and then how to figure out to work to about 60% of that. And that way you're doing that for at least 20 minutes and you're getting the best cardio output, and that will really work on getting you in the best shape and lowering your blood pressure.
Cardiovascular and neurovascular disease is very strongly related. If you have history of heart disease, blocked blood vessels in the heart, chances are that you also have some blocked blood vessels going to the brain because those blood vessels are at risk for the same problems that affect the blood vessels in the heart. Classic signs of someone having a stroke could be sudden onset of a new neurologic deficit. And so that means numbness on one side of the body or the other, weakness on one side of the body or the other. It could be visual loss, it could be speech difficulty, not being able to understand speech or express speech, visual loss, anything that comes on that's new for you. Even an acute headache that's not typical for you could be a warning sign of a stroke. And it's important because if you come to an emergency room early on, there are some treatments that can be given to you within a 3 to 4.5 hour window period that you will not be eligible for if you don't present early enough.
The heart and the vascular system are very much intertwined because if you have disease in the heart, you undoubtedly have disease elsewhere and vice versa. So if you find out through a screening test, for instance, you have blockages somewhere else in the body besides the heart, you can almost bet that you have heart disease and therefore you need to have your heart checked out as well. And the same ways to prevent heart disease can be extrapolated in terms of how you prevent vascular disease as well. It's all the same atherosclerosis or hardening of the arteries going on throughout the entire body. It's just affecting different systems. And the treatment for both is oftentimes very, very similar.
The two most important recommendations for prevention are first, taking medications that we know work. Cholesterol medicine, blood pressure medicine, that dramatically reduces the chance of a heart attack or needing bypass surgery or angioplasty. And second is exercise and controlling weight. Exercise helps you lose weight. It does help you kind of decrease stress levels, and you tend to feel better, and your actual rate of having heart attacks and complications goes down. Sometimes it can be as simple as walking the dog twice a day, or going to the gym or walking with a friend. It doesn't have to be extreme exercise, but it just needs to be on a regular basis, 3 or 4 times a week.
Patients can take into their own hands a few different things. What I tell to all individuals who have never seen a physician is to know their risks, know their overall cardiovascular risk. And the risk can really be comprised in 5 different categories. One is presence or absence of high blood pressure, presence or absence of diabetes, their cholesterol profile, whether or not there is a smoking history and their family history. Those 5 things really comprise their overall risk, and based on that risk, what diagnostic procedure is appropriate.
Learn your risk today. Summit Medical Group's accredited vascular lab offers 3 vascular screenings in one 10-minute visit, assessing your carotid artery health, risk for abdominal aortic aneurysms, and peripheral arterial disease. A board-certified vascular surgeon will review your results, which are available immediately. Call 908-277-8800 to schedule an appointment.